Can you tell us a little bit about the history of environmental medicine movement in America?
Well, if you look back in the history of the United States, medically in the 40s and 50s, allergists were really starting to acknowledge that people were reacting to their environment, both the foods that they eat and the exposures that they have in terms of chemical exposures or toxicant exposures. And so those allergists actually started the first Environmental Medicine Association, which became the American Academy of Environmental Medicine. Along the way, they gathered primary care providers who were noticing that people were reacting to their environment and getting very, very sick. So this included not only pesticide exposures, but exposures to household cleaning products and, exposures to foods that contained high amounts of heavy metals like mercury. So in the last, I would say, 30 years, how that has evolved is our total body loads have increased significantly. The number of clinicians who've recognized that environmental medicine is necessary in any primary care practice have grown. And so we have this whole new subspecialty in medicine called environmental medicine, which is kind of a fledgling specialty area. The docs in the AAEM, the American Academy of Environmental Medicine, are limited mostly by their culture. They're older doctors. They're newer doctors that are getting trained in functional medicine with a smattering of environmental medicine training in that. And then in my profession, the naturopathic profession, because of the nature of our understanding of treating the cause of disease, we gravitate towards environmental medicine. And now at this conference, what we're really starting to realize is the enormity of the problem. We have an epidemic of Alzheimer's and Parkinson's and adult onset early dementias in this country that in large part are caused by neuroinflammation resulting from toxicant exposure. So what we're attempting to teach these physicians is, who is it? How do you recognize it? Everybody has a toxic body burden. The Center for Disease Control has identified over 100 toxicants that are ubiquitous. In other words, we can measure them in everyone. Everyone, whether they are a newborn or whether they are elderly. And so to take those toxicant exposures and really figure out in whom are they causative for chronic disease. How do you identify that? How do you measure them? And how do you look at the intersection between signs and symptoms and exposures? So it's a big job, but we feel like it's a necessary job in order for us to be able to move forward and stem this rising tide of chronic degenerative disease. There's a tsunami, as you know, James, in both insulin insensitivity, prediabetes, diabetes, neurodegenerative diseases, autoimmune disease, cancer. I could go on and on.
Absolutely. So for a doctor that comes to one of these conferences, or this conference particularly, at the end of the conference, what will they be able to do?
Several things. One is, what are the red flags? We recognize red flags in patients' presentation that signal toxicant exposure. So the signs and symptoms, what particular laboratory testing is going to elicit that, and what physical exam testing is going to elicit that. Second, how do you do a good intake on a patient to determine whether or not they have toxicant exposure? This is an art and a practice, and it's learnable. And so we actually teach intake. So intake would maybe necessitate a little bit more time with the patient. I had the good fortune of working in a multidisciplinary clinic with several physicians, et cetera, where my job was to look for environmental exposures and actually elicit that information. So I would do a lot of Q&A with the patients, and the intake form, which is, there's a specialty intake form for environmental medicine, isn't always complete. For instance, if I asked you if you ate fish, and you said, no, I don't really eat that much fish, then I'd have to figure out whether you think tuna fish is a fish or not. Because many patients don't even think that their tuna fish salad qualifies as a fish when it's the highest dietary source of mercury in most of the people in the United States because of the frequency with which it's eaten. So another area is really figuring out not only what clinical laboratory tests to do, but how to interpret them. And this is crucial because the laboratories, by law, have to use certain reference ranges in their interpretation of the data based on their own populations, based on their own data. They do not necessarily reflect risk level and don't necessarily reflect a diagnosis. So we then have to go into the epidemiological literature and the Center for Disease Control databases and elicit those reference ranges and teach them. And this is because this is a new science. The Center for Disease Control, NIEHS, is working very hard on this. The ATSDR, the Agency for Toxic Substances and Disease Registry, is working very hard to really try and figure out who are the risk populations for toxicant exposure. But there's no textbook yet on this.